A 7-year-old girl wakes from emergency surgery barely alive. With trembling hands, she scrawls 2 words on a whiteboard that make her mother's blood run cold. Help him. Doctors thought they saved her life, but she's not worried about herself. Someone else is dying, and only she knows. Before we dive in, comment where in the world you are watching from and don't forget to click subscribe. Sarah Chen pressed her hand against her daughter's stomach and felt her heart skip. The firmness beneath her palm wasn't normal. It couldn't be. Emma was only 7 years old, and in the last 3 weeks her belly had swollen to the size of a basketball. Sarah had convinced herself it was just bloating, maybe a growth spurt. But standing here in Emma's bedroom, with the afternoon light cutting through the blinds, she could no longer ignore the truth staring back at her. Something was terribly wrong. "Mommy, it hurts when I press on it," Emma said, her voice small and uncertain. She was sitting on the edge of her bed wearing her favorite unicorn pajamas, the ones that had fit perfectly just a month ago, but now pulled tight across her distended abdomen. Her thin arms and legs made the swelling even more pronounced, like someone had inflated only the middle part of her small body. Sarah tried to keep her voice steady. "How long has it been hurting, sweetie?" Emma shrugged, her eyes dropping to the floor. "I don't know. A few days. I didn't want to say anything because I didn't want to miss Ashley's birthday party. The birthday party had been yesterday." Sarah remembered Emma had barely eaten anything, just pushed the cake around her plate while the other children played. She'd thought Emma was just being picky, going through one of those phases. But now, seeing the way her daughter's hand protectively cradled her stomach, Sarah felt a wave of guilt wash over her. How had she missed this? "We're going to see Dr. Morrison tomorrow," Sarah said, forcing brightness into her tone. "She'll know what's going on." Emma's face crumpled. "Do I have to get a shot?" "Maybe not. Maybe she'll just look at your tummy and give you some medicine." Sarah hoped it was that simple. She prayed it was that simple. But the hardness she'd felt beneath her daughter's skin told a different story, one that made her stomach twist with dread. That night, after Emma had finally fallen asleep, Sarah sat at the kitchen table with her husband Mark. The house was quiet, except for the hum of the refrigerator and the occasional creak of the old radiator. Mark had his laptop open, but he wasn't looking at the screen. He was staring at his coffee mug, his jaw tight. "I looked it up," he said finally. "Abdominal distension in children. The causes range from constipation to..." He stopped, unable to finish the sentence. "Don't," Sarah said sharply. "Don't go down that road. We'll see the doctor tomorrow and she'll tell us what's happening. No more internet diagnosis." But Sarah had done her own searching earlier, upstairs in the bathroom with the door locked so Emma wouldn't hear her crying. The possibilities were endless and terrifying. Fluid accumulation, organ enlargement, masses, tumors. The word she couldn't say out loud, the one that made her throat close up. Mark reached across the table and took her hand. His palm was sweaty. "She's been so tired lately. Remember last week when she fell asleep at 5 in the afternoon? That's not normal." Sarah had noticed. Emma, who used to run around the backyard until dark, who never wanted bedtime to come, had been napping daily. Her appetite had decreased too, though she'd been drinking more water than usual. Sarah had attributed it all to the end of the school year, the heat, growing pains. She'd been so good at explaining away every symptom. "First thing tomorrow," Sarah whispered. "We'll call first thing tomorrow." But morning came with its own complication. Sarah woke to find Emma standing in the doorway of her bedroom, tears streaming down her face. "Mommy, I had an accident." At 7 years old, Emma hadn't wet the bed in years. Sarah rushed to her daughter's room and felt her stomach drop. The bed was soaked, but it wasn't urine. The sheets were stained with something darker, something that made Sarah's hands shake as she helped Emma out of her pajamas. "Does it hurt when you go to the bathroom?" Sarah asked, trying to keep the panic out of her voice. Emma nodded. "It burns. And my tummy feels really tight, like it might pop." Sarah didn't wait until morning. She called Dr. Morrison's emergency line at 6 a.m., and by 7:30, they were sitting in an examination room at the pediatric clinic. The walls were painted with cheerful animals, But Sarah couldn't focus on anything except Emma's distended stomach and the worried crease between Dr. Morrison's eyebrows as she palpated her daughter's abdomen. Dr. Elaine Morrison had been Emma's pediatrician since birth. She was usually warm and reassuring, quick with a joke to make nervous children laugh. But today her movements were careful, deliberate. She pressed gently on different areas of Emma's stomach, watching her patient's face for signs of pain. "Emma, can you tell me if this hurts?" Dr. Morrison pressed on the lower right side. Emma winced. "A little." "And here?" The doctor moved to the left side. "More," Emma said, her voice tight. Dr. Morrison straightened up and gestured for Sarah to step outside the examination room. In the hallway, she spoke quietly. "I want to do some immediate tests. Blood work and urinalysis to start. Her abdomen is definitely distended and there's some tenderness that concerns me. Has she been eating normally?" Sarah shook her head. "She's barely touched her food for the past week, but she's been drinking a lot of water. And this morning?" She explained about the bedwetting, the discoloration. Dr. Morrison's expression grew more serious. "I'm going to be honest with you, Sarah. This presentation is concerning. The rapid abdominal distension, the constitutional symptoms like fatigue, the changes in urination. We need to rule out several possibilities, some more serious than others. I want to get her in for an ultrasound today." "Today?" Sarah's voice came out as a squeak. "You mean like right now?" "I'm calling ahead to the radiology department at Mercy General. They can fit her in this afternoon. In the meantime, I'm going to draw blood and get some baseline values. How long would you say her stomach has been this distended?" Sarah tried to think. 3 weeks, maybe? It seemed gradual at first. I thought she was just eating too much, putting on weight. But it's gotten much worse in the last week. Has she had any trauma? Any falls or impacts to her abdomen? No, nothing like that. She's been mostly quiet, actually. Not running around like she usually does. Dr. Morrison nodded, making notes on her tablet. "Okay. Let's get the blood draw done and I'll make those calls. Try not to worry too much just yet. There are benign explanations for this, but we need to investigate thoroughly." "Try not to worry." Sarah almost laughed at the impossibility of that request. She went back into the examination room, where Emma sat on the paper-covered table, swinging her legs. Mark had arrived while they were talking and stood beside Emma, his hand on her shoulder. "Am I sick?" Emma asked, looking between her parents. "Dr. Morrison is going to run some tests to figure out what's making your tummy so big," Sarah said. "You're going to get to see a special machine today that takes pictures of the inside of your body." Emma's eyes widened. "Like an X-ray?" "Similar. It's called an ultrasound. It doesn't hurt at all. The blood draw was harder." Emma cried, and had to be held still, and Sarah felt each of her daughter's tears like a knife to her chest. But it was over quickly, and then they were told to go home and return at 2 o'clock for the ultrasound. The hours crawled by with agonizing slowness. Sarah tried to keep Emma comfortable, setting her up on the couch with pillows and her favorite movies. But Emma kept shifting, unable to find a position that didn't put pressure on her swollen stomach. She ate a few bites of soup for lunch but pushed the bowl away after barely making a dent. Mark paced between the living room and the kitchen, his phone pressed to his ear as he explained the situation to his boss and asked for the rest of the week off. Through the doorway, Sarah could hear the strain in his voice, the way he kept saying, "We don't know yet," and "just some tests." At 1:30, they loaded Emma into the car and drove to Mercy General Hospital. The pediatric radiology department was on the 3rd floor, decorated with underwater themes. Fish and dolphins swam across the walls, but the atmosphere was tense. Other parents sat in the waiting room with their children, all wearing the same expression of barely contained fear. They only waited 15 minutes before Emma's name was called. A technician named Lisa, young with bright purple hair, smiled at Emma, and immediately started chatting about the cartoon characters on Emma's shirt. Sarah was grateful for the distraction. They were led into a dim room dominated by an ultrasound machine. "This is going to feel cold," Lisa said, squirting gel onto Emma's stomach, "but it won't hurt. You might feel a little pressure as I move the wand around, but that's it. I need you to lie very still for me, okay?" Emma nodded, her small hand finding Sarah's and gripping tight. Lisa began moving the ultrasound probe across Emma's distended abdomen, her eyes fixed on the screen. Sarah tried to interpret the grayscale images but could make no sense of the shapes and shadows. Lisa's expression remained neutral and professional as she clicked buttons, taking measurements, moving the probe to different areas. After what felt like an eternity but was probably only 20 minutes, Lisa set down the probe and wiped the gel from Emma's stomach. "All done, sweetheart. You were very brave." "When will we know the results?" Mark asked. "The radiologist will review the images and send a report to Dr. Morrison. It usually takes a few hours, but given the circumstances, they'll prioritize it." Given the circumstances. Sarah's hands went cold. She thanked Lisa and helped Emma back into her shirt, her mind racing with possibilities. What had Lisa seen? Had there been something in those images that concerned her? The technician had given nothing away, but Sarah had felt the slightly longer pauses, the extra images taken of one particular area. They drove home in silence, Emma dozing in the back seat. Sarah's phone sat in her lap, volume turned all the way up so she wouldn't miss Dr. Morrison's call. Mark kept glancing at her, then at the road, then back at her. Neither of them spoke. There was nothing to say that wouldn't give voice to the terror building between them. At home, Sarah settled Emma back on the couch. Her daughter's skin looked paler than it had that morning, and there were dark circles under her eyes that hadn't been there before. Or had they? Was Sarah only noticing now because she was finally paying attention to all the signs she'd been missing? The call came at 4:30. Sarah grabbed her phone so fast she nearly dropped it. "Dr. Morrison?" "Sarah, I need you to bring Emma back to the hospital right now." The doctor's voice was calm but urgent, the tone of someone trying not to cause panic, but needing immediate action. The ultrasound showed significant fluid accumulation in her abdomen, much more than I expected. "I've consulted with a pediatric surgeon, and we need to see her right away." "Fluid? What kind of fluid?" Sarah's voice was shaking. "That's what we need to determine. It could be several things, but the volume is concerning. I'm at the hospital now. Come directly to the emergency department and tell them I'm expecting you. Don't stop to pack a bag or anything else. Just come now." The line went dead. Sarah stared at the phone, her brain struggling to process the words. Significant fluid accumulation. Pediatric surgeon. Emergency department. "Mark," she called out, her voice barely above a whisper. He appeared in the doorway, took one look at her face and reached for his keys. "What did she say?" "We have to go back. Right now. There's fluid in her abdomen." They moved on autopilot. Mark scooped Emma up from the couch while Sarah grabbed her purse. Emma, still drowsy, didn't protest. The drive to the hospital was a blur. Sarah couldn't remember later if they hit red lights, or if Mark drove too fast, or if they talked at all. All she remembered was the feeling of her heart trying to beat its way out of her chest, and the sight of Emma's swollen stomach rising and falling with each breath. At the emergency department, they were taken back immediately. A nurse led them to a private room where Dr. Morrison waited with a man Sarah didn't recognize. He was older, maybe 55, with graying hair and kind eyes. "This is Dr. Richard Keller, our chief of pediatric surgery," Dr. Morrison said. Dr. Keller shook their hands and examined Emma gently. Sarah saw Emma flinch when he pressed her lower left side. He exchanged a look with Dr. Morrison that made Sarah's blood run cold. "Mr. and Mrs. Chen, I've reviewed Emma's ultrasound. I'll be direct, because time is important. Emma has approximately 2 liters of fluid in her abdominal cavity. That's extremely abnormal for a child her size. The fluid is putting pressure on her organs, and we need to find out where it's coming from." 2 liters? Mark repeated. "How?" "That's what we need to determine. I want to do an emergency exploratory procedure. We'll make a small incision and insert a camera to visualize what's happening inside. We'll drain some fluid for analysis. This will tell us if we're dealing with infection, perforation, internal bleeding, or something else." "Surgery?" "Right now, as soon as possible. The pressure is dangerous. It's impacting her breathing, kidney function, circulation. Every hour we wait increases complications." "But what could cause this?" "She hasn't been in an accident." Dr. Keller held up a hand gently. "Many possible causes. Sometimes infection creates fluid, sometimes a bleed, sometimes organ issues. We won't know until we look. But I need your permission." Sarah looked at Mark. His face had gone white. "Is there any other option?" "We could do more imaging, but that only delays treatment. Based on what I'm seeing, surgical exploration is the best way to diagnose and address the problem simultaneously." Emma started crying. "I don't want surgery. Mommy, please." Sarah pulled her daughter close, tears streaming down her face. "I know, baby. But Dr. Keller is going to help you feel better." The next hour moved with frightening speed. Consent forms, a surgical team, an anesthesiologist. Emma was given a sedative and her eyes grew heavy. "You're going to wait right here for me," Emma mumbled. "Right here," Sarah promised. "I'm not going anywhere." They wheeled Emma away at 6:15. Sarah and Mark were directed to a surgical waiting room on the 4th floor. It was empty except for them. Mark sat with his head in his hands. Sarah paced, her mind spinning through scenarios, each worse than the last. What had they missed? She was Emma's mother. She was supposed to protect her. 3 weeks. Emma's stomach had been growing for 3 weeks. "Stop," Mark said quietly. "This isn't your fault. She's been in pain. We both thought it was normal. You couldn't have known. But mothers were supposed to know. Mothers were supposed to have that instinct, and Sarah had ignored it." At 7:30, a nurse gave an update. "Everything's going smoothly. Dr. Keller is beginning the procedure now. He'll come speak with you when he's finished." "How much longer?" "Hard to say. Could be another hour, could be longer. Try to stay comfortable." Mark went to the cafeteria and came back with sandwiches neither could eat. Sarah's parents called, then Mark's mother. They told everyone the same thing. Emma was in surgery. They didn't know anything yet. At 8:45, the door opened and Dr. Keller walked in. He'd changed out of his scrubs. Sarah saw his face, the deep lines around his mouth, the way he took a breath before speaking. "Mr. and Mrs. Chen, I need you to prepare yourselves. What we found was not what any of us expected." Sarah's knees buckled. Mark caught her. "What? What did you find?" Dr. Keller sat down across from them. "We found massive internal bleeding. Emma's spleen ruptured at some point in the last few weeks, and she's been slowly bleeding into her abdominal cavity. The 2 liters of fluid was actually blood." "Ruptured spleen?" Mark's voice was barely audible. "How?" "She didn't fall. That's the concerning part. There's no obvious trauma. When a spleen ruptures without traumatic injury, we have to consider other causes: infection, disease, abnormalities in the organ itself." He paused. "We removed her spleen. We had no choice. It was destroyed and the source of the hemorrhage. Emma lost significant blood. We're transfusing her now." Sarah felt like she was underwater. Her daughter had been bleeding internally for weeks. How had Emma not been sicker? "Will she be okay?" "She's stable now, but the next 24 hours are critical. We need to monitor her closely. She's young. She's otherwise healthy. But there's something else." Dr. Keller's expression grew graver. "When examining her spleen, I found evidence of old scarring, injuries that had partially healed before this rupture." "Old injuries? What does that mean?" This wasn't the first time Emma's spleen was damaged. There were signs of previous trauma, possibly from weeks or months ago. The room went silent. Old injuries meant this had been happening longer than they knew. "But she never complained," Sarah said desperately. "Children sometimes don't recognize internal pain as serious. They might think it's normal, or be afraid to tell their parents. Emma's very brave, but also very young. She may not have understood what she was feeling." "Can we see her?" "She's in recovery. Once she's moved to the pediatric intensive care unit, you can sit with her. But I need to tell you something else. Given the pattern of injuries and lack of reported trauma, I'm required to report this to Child Protective Services. They'll investigate to ensure Emma hasn't been subjected to abuse." "Abuse?" Sarah's voice came out as a shriek. "You think we hurt her?" "I don't think anything yet. But unexplained internal injuries in a child require investigation. It's protocol, for Emma's protection. This is standard procedure." "When can we see her?" About 30 minutes. Someone will come get you. Dr. Keller left. Sarah collapsed against Mark. They held each other, both crying, both terrified. Emma was alive. That was what mattered. But the nightmare wasn't over. A nurse came 30 minutes later. They followed her through hallways to the pediatric intensive care unit. Dimmed lights, soft beeping, hushed voices. Emma's room was at the end of the hall. Emma looked so small, so fragile. Still unconscious, her face pale except for bruising around her eyes. An IV line ran from her arm to a bag of blood. Other tubes and wires connected her to monitors. A ventilator breathed for her with rhythmic hiss and sigh. Sarah moved to the bedside and took Emma's small hand. The fingers were cold. "I'm here, baby. Mommy's here." A nurse named Patricia explained the equipment. Emma would likely sleep through the night as anesthesia wore off. They'd keep her sedated to help her body heal. The transfusion would continue. Vitals would be monitored constantly. "Can you tell us what happened during surgery?" Sarah asked. Patricia hesitated. "Dr. Keller gave you the details, but Emma lost about 30% of her blood volume. That's significant for an adult, critical for a child her size. If you'd waited even another day." She didn't finish. Emma could have died if Dr. Morrison hadn't ordered that emergency ultrasound, if they'd gone home and waited. Mark pulled a chair close. "The doctor said there were old injuries." "What does that mean?" Patricia checked monitors. "I can't speak to that. You'd need to ask Dr. Keller or wait for the pathology report. But Emma is stable right now, and that's what we focus on. One moment at a time." The hours passed slowly. Mark dozed. Sarah couldn't sleep. She held Emma's hand and watched her chest rise and fall. Nurses came and went. No one said much. At 3 in the morning, a woman in a business suit appeared. She was young, maybe 30, with dark hair pulled back. "I'm Detective Rebecca Torres with Child Protective Unit. I need to ask you both some questions about Emma's medical history and the events leading to tonight." Mark tensed. "Our daughter just came out of surgery. Can't this wait?" "Time is important in these cases. The sooner I gather information, the better." Dr. Keller reported concerns about Emma's injuries. For the next hour, Torres asked questions. When had they first noticed Emma's stomach was distended? Had Emma complained of pain before? Had there been any falls? Any accidents? Did anyone else care for Emma regularly? Had there been any changes in Emma's behavior? Sarah answered, but the questions felt like accusations. Each one made her feel more like a failure as a parent. "Has Emma ever mentioned anyone hurting her?" Torres asked. "At school or anywhere else?" "No," Sarah said firmly. "Never. Emma loves school. Her teachers adore her. No one would hurt her." "What about at home?" "Any instances where Emma might have been injured, even accidentally?" Mark's jaw tightened. "Are you asking if we hurt our daughter?" "I'm asking about any possible cause for the injuries Dr. Keller found. Old trauma doesn't happen without cause. Something happened to Emma, possibly more than once." "We don't know," Sarah said desperately. "If we knew Emma was hurt, we would have gotten help immediately. We love our daughter. We would never..." Her voice broke. Torres's expression softened slightly. "I believe you care about Emma. But my job is to investigate. I'll need to speak with Emma's teachers, her doctors, anyone who has regular contact with her. And I'll need to speak with Emma when she's able. Until this investigation is complete, you'll have supervised visits." "Supervised?" Mark stood. "You're saying we can't be alone with our own daughter?" "It's protocol in cases of suspected abuse." "I'm sorry." After Torres left, Sarah and Mark sat in stunned silence. Just yesterday, Emma had been sleeping in her own bed. Now she was fighting for her life, and they were being investigated for child abuse. A soft knock made them jump. Dr. Morrison stepped in, still in yesterday's clothes, looking exhausted. "I heard about the surgery. I wanted to check on Emma, and on both of you." "They think we hurt her," Sarah said flatly. Dr. Morrison checked Emma's chart. "The investigation is necessary. It's not about whether I think you hurt Emma. It's about following protocol when a child has unexplained injuries. The system is designed to protect children. But Emma wasn't abused, Mark said. And the investigation will help find that explanation. I've ordered additional blood tests. We're looking at clotting disorders, autoimmune conditions, anything that might explain a spontaneous splenic rupture. We'll figure this out. After she left, Sarah lay her head on Emma's bed. Somewhere between fear and exhaustion, she finally fell asleep. She woke to alarms. Harsh, insistent beeping. She jerked upright to see nurses rushing in. One adjusted the ventilator while another checked IV lines. Emma's vital signs were wrong. Sarah didn't understand the numbers, but she understood panic. "What's happening?" she demanded. "Her oxygen saturation is dropping," one nurse said tersely. Another alarm joined the first. More people rushed in. Someone was calling for a doctor. Emma's small body jerked as they adjusted equipment. Sarah and Mark were pushed back against the wall. "Come on, Emma," one nurse muttered. "Come on, sweetie." The oxygen numbers climbed slowly, agonizingly slowly. After what felt like hours but was probably minutes, the alarms fell silent. The team stepped back. Emma was stable. Dr. Keller arrived, half asleep. He examined Emma carefully, reviewed monitors, spoke quietly with nurses. Then he turned to Sarah and Mark. "We may have a complication. Emma's lungs aren't expanding properly. It's possible she has fluid building up there as well. I've ordered a chest x-ray. More waiting." The x-ray machine was wheeled in. They took images while Sarah and Mark stood in the hallway watching through the window. Emma never moved, never opened her eyes. When Dr. Keller came back, his face was grim. "There's fluid in both lungs. Not a lot yet, but it's there. Combined with what we found in her abdomen, this suggests a more systemic issue. Emma's not just bleeding from one injury. Something else is going on." "Like what?" Mark asked. "That's what we're trying to determine. I've called in a pediatric hematologist. We're looking at her blood under a microscope right now. If there's a clotting disorder or something affecting how her blood vessels function, that might explain both the splenic rupture and the fluid in her lungs." "Is she going to be okay?" Dr. Keller met her eyes. "I don't know. I wish I could tell you yes with certainty. But Emma is very sick. We're doing everything we can. The next few hours will tell us a lot. The next few hours." Sarah wanted to scream, wanted to demand he fix this right now, but she knew he couldn't. All they could do was wait and hope Emma was strong enough to fight. Dawn broke outside the PICU windows. Sarah hadn't left Emma's side except for the bathroom. Mark had gone home briefly to shower, but returned within an hour. They sat on either side of Emma's bed, each holding one of her hands, waiting for some sign she would wake up. At 8:30, Dr. Morrison returned with another doctor, a woman with short silver hair and sharp eyes. "This is Dr. Patricia Huang, our pediatric hematologist. She's been reviewing Emma's blood work." Dr. Huang moved directly to the point. "Emma's platelet count is critically low. Platelets help blood clot, and hers are less than a quarter of what they should be. This explains the bleeding and why her spleen ruptured with no apparent trauma. Low platelets make blood vessels fragile. Even minor bumps or normal activity can cause internal bleeding." "Is it cancer?" The words burst out of Sarah. "We don't know yet. Low platelet counts can be caused by many things: immune disorders, viral infections, bone marrow problems. We've taken samples, but results will take time. In the meantime, we're treating Emma with platelet transfusions and medications to help her body produce more and stop the bleeding." "But you don't know what's causing it?" "Not yet. But finding the low platelets is actually good news in a way. It gives us a target for treatment. We know what we're fighting now, even if we don't know why." The morning brought more visitors. Sarah's parents arrived. Mark's brother came with coffee. Friends sent messages. Everyone wanted to help, but no one could. There was nothing to do but wait. At noon, Detective Torres returned. She pulled Sarah and Mark into a conference room. "I've spoken with Emma's teachers and the school nurse. No one reported signs of abuse or unusual injuries. Her last school physical was 6 months ago and showed nothing abnormal. I've reviewed your home, and there are no signs of unsafe conditions. So you believe us?" "I believe you didn't intentionally harm Emma, but I still need to understand what caused her injuries. Dr. Huang briefed me on the platelet disorder. That's a medical explanation, which changes the investigation. However, I still need to document everything. Until Emma can talk to me herself, the case remains open. It wasn't complete exoneration, but it was something. They weren't being accused anymore. Back in Emma's room, the afternoon stretched endlessly. Nurses changed shifts, doctors came and went. Emma remained unconscious. The machines beeped their steady rhythms. Time lost all meaning. At 4 in the afternoon, Emma's fingers twitched in Sarah's hand. Sarah's eyes snapped to her daughter's face. Emma? Emma, baby, can you hear me? Emma's eyelids fluttered. Her mouth moved around the ventilator tube. She made a small sound of distress. Nurse, Mark called. She's waking up. Patricia rushed in, checking monitors. Emma, I need you to stay calm. You have a tube in your throat to help you breathe. Don't try to pull it out. Can you squeeze your mom's hand if you understand me? Emma's fingers tightened weakly. Good girl. You're in the hospital. You've been very sick, but you're getting better. Your mom and dad are right here with you. Emma's eyes opened fully, confused and frightened. They locked on Sarah's face. Tears began to leak from the corners. It's okay, sweetie, Sarah whispered, her own tears falling. You're okay. We're right here. We're not leaving. Dr. Keller was called. He examined Emma carefully. Emma, I'm going to ask yes or no questions. Squeeze once for yes, twice for no. Do you understand? 1 squeeze. Are you in pain right now? 1 squeeze. Is the pain very bad? 2 squeezes. Good. We're giving you medicine for the pain. Emma, do you remember what happened? Do you remember coming to the hospital? 1 squeeze. Do you remember your tummy hurting? 1 squeeze. Then Emma's whole body tensed. Her eyes went wide. She made urgent sounds around the ventilator tube, her free hand coming up to claw at it. Emma, don't pull at the tube. Dr. Keller grabbed her wrist gently. I know it's uncomfortable. We're going to take it out soon, but right now you need it. Try to relax and breathe with the machine. But Emma wasn't calming down. She was struggling, her eyes wild. The monitors began beeping as her heart rate spiked. She was trying to say something, trying desperately to communicate. Get me a pen and paper, Dr. Keller ordered. A nurse brought a whiteboard and marker. Dr. Keller placed it in Emma's trembling hands. Emma, can you write what you want to tell us? Emma's hand shook so badly she could barely hold the marker. But slowly, with agonizing effort, she scrawled 2 words in shaky letters. Sarah leaned closer to read them. Her blood went cold. The words were HELPHIM. Sarah stared at the words on the whiteboard. Help him. Not help me. Him. Emma, who needs help? Who are you talking about? Emma's hand was already moving again, scratching out more letters. Her movements were frantic, desperate. The marker squeaked against the board as she wrote, Tyler hurt bad. Mark leaned forward. Tyler? Tyler Morrison? Your friend from school? Emma squeezed once. Yes. Then she started writing again, but her hand was shaking too hard. The letters came out as jagged scribbles. She made a sound of frustration and dropped the marker. Her eyes pleaded with them to understand. Emma, slow down, Dr. Keller said. Take a breath. What happened to Tyler? Is he hurt? 1 squeeze. Yes. Then Emma's eyes rolled back and her body went limp. The machines erupted into alarms again. She's seizing, Dr. Keller shouted. Get me 2 milligrams of lorazepam now. Sarah was pushed back as the medical team swarmed Emma's bed once more. She watched in horror as her daughter's small body convulsed, muscles contracting violently despite the medications being pushed into her IV. It lasted 45 seconds that felt like 45 hours. Finally, Emma's body relaxed, and the alarms quieted. But she didn't wake up again. She'd slipped back into unconsciousness. What's happening to her? Sarah's voice was raw. Why is everything getting worse? Dr. Keller was checking the monitors, his jaw tight. Her brain may be swelling. That's a risk with significant blood loss, and the trauma her body's been through. I'm ordering a CT scan immediately. But Sarah barely heard him. Her mind was stuck on those 2 words Emma had written. Tyler Morrison. Dr. Morrison's son. He was in Emma's class, a quiet boy with sandy hair and an easy smile. Sarah had seen him at school events, birthday parties. Emma and Tyler were friends, but not particularly close. Why would Emma's first conscious thought be about him? While the medical team prepared to take Emma for the CT scan, Sarah pulled out her phone with shaking hands. She found Dr. Morrison's number and called. It went to voicemail. She tried again. Still voicemail. On the 3rd try, a groggy voice answered. "This is Dr. Morrison." "Elaine, it's Sarah Chen. I'm sorry to call so late, but..." "Sarah? Is Emma okay?" She woke up briefly. She had a seizure, but she's stable now. But Elaine, she said something strange. She wrote that Tyler needs help. That he's hurt badly. "Is Tyler okay?" There was a long pause on the other end. Tyler's fine. He's at his father's house this week. Why would Emma say that? I don't know, but she was very upset about it. Very insistent. "Can you call David and check on Tyler, please?" Another pause. "Sarah, I think Emma might be confused from the medications and everything she's been through. It's not unusual for patients to have strange thoughts or hallucinations." "Please," Sarah interrupted. "Just check." Emma was so worried. So scared. "Just make sure Tyler's okay." "All right. I'll call David." "But Sarah, Emma needs to be your focus right now. Whatever she thought she saw or remembered, it can wait." The call ended. Sarah stood in the hallway outside Emma's room, watching through the window as they prepared her daughter for transport to radiology. Mark came to stand beside her. "What did Dr. Morrison say?" "She's going to check on Tyler. But she thinks Emma was just confused." "She probably is," Mark said quietly. "The seizure, the medications, everything she's been through. Her brain's not working right. You heard what Dr. Keller said about swelling." Sarah knew he was right. But something about the intensity in Emma's eyes, the desperation with which she'd written those words, wouldn't let go. Help him. Tyler hurt bad. What if it wasn't confusion? What if Emma really knew something? They followed Emma's bed down the hall to radiology. The CT scan took 20 minutes. 20 minutes of standing outside a closed door, waiting. When they brought Emma back to the PICU, Dr. Keller met them with results. "There is some minor swelling, but it's not as bad as I feared. The seizure was likely caused by electrolyte imbalances from the blood loss and transfusions. We're correcting those now. Emma should regain consciousness once the sedatives wear off." "Should?" Sarah caught the word. "You're not certain? With traumatic injuries like this, nothing is certain. But I'm cautiously optimistic. Emma's young. Her brain is resilient. We just need to give her time to heal. Time. It was all anyone could give them. Time and hope and prayers that Emma would pull through." Sarah returned to the chair beside her daughter's bed and took her hand once more. The skin was warmer now, which the nurses said was a good sign. Color was returning to Emma's cheeks. The monitors showed stable vitals. All good signs. But Emma still wasn't waking up. At midnight, Sarah's phone rang. Dr. Morrison's number. Sarah answered immediately. "Sarah, I spoke with David. He said, Tyler is fine. He's asleep in bed. No injuries, nothing wrong. I think what Emma experienced was a dream or hallucination. You don't need to worry about Tyler." Relief flooded through Sarah, but it was tinged with confusion. "Okay, thank you for checking. How's Emma doing?" Sarah filled her in on the CT scan and the doctor's cautious optimism. They spoke for a few more minutes before ending the call. Sarah relayed the information to Mark. "See?" he said. "Tyler's fine. Emma was just confused." Sarah wanted to believe that. She did believe it. But a small voice in the back of her mind kept whispering that something wasn't right. Emma had been so sure, so frightened. Help him. Tyler hurt bad. Those weren't the words of a confused child having a medication-induced dream. They were the words of someone who knew something terrible. "Stop it," Sarah told herself firmly. You're exhausted and terrified and seeing problems where there aren't any. Tyler is fine. Focus on Emma. She forced herself to eat one of the sandwiches Mark had brought earlier. It tasted like cardboard, but she knew she needed fuel. Mark dozed in his chair. The night shift nurses made their rounds. Everything was quiet. Peaceful, even. Emma's monitors beeped their steady rhythm. Her chest rose and fell. She was alive. She was stable. That had to be enough. At 3 a.m, Emma's eyes opened. This time there was no panic, no struggling. She looked around the room slowly, her gaze eventually landing on Sarah. Recognition flickered in her eyes. "Mommy," she mouthed around the ventilator tube. The word had no sound, but Sarah understood it. "I'm here, baby. I'm right here." Sarah leaned close, brushing hair from Emma's forehead. "You're going to be okay. The doctors are taking such good care of you." Emma's hand moved to the ventilator tube again, not frantically this time, but with clear intent. She wanted it out. Sarah pressed the call button. A nurse arrived within seconds. "She's awake and she wants the tube out." "Is that possible?" The nurse checked the monitors and Emma's breathing patterns. "Her oxygen levels are good. Let me get Dr. Keller." 10 minutes later, Dr. Keller arrived looking far more awake than any person should at 3 a.m. He examined Emma thoroughly. "Emma, I'm going to ask you to take some deep breaths for me. I need to see how well your lungs are working on their own before we remove the ventilator. Can you do that?" Emma nodded slightly and tried to take deeper breaths. Dr. Keller watched the monitors carefully. After several minutes, he made a decision. "All right. We're going to extubate you. It's going to feel weird and uncomfortable for a moment, but then you'll be able to breathe and talk on your own. Ready?" Emma squeezed Sarah's hand once. Yes. The process was quick, but looked painful. Emma gagged as the tube was removed, coughing and gasping. Dr. Keller held an oxygen mask over her face. "Breathe slowly. In through your nose, out through your mouth. That's it. You're doing great." Emma's coughs gradually subsided. Her breathing evened out. Dr. Keller removed the oxygen mask and replaced it with a simple nasal cannula. "How do you feel?" "Hurts," Emma whispered, her voice hoarse and rough from the tube. She touched her throat gingerly. "Your throat will be sore for a while. We'll get you some ice chips to help with that. Emma, do you remember what happened? Do you remember being in the hospital?" Emma nodded slowly. "My tummy hurt. Really bad." Her eyes filled with tears. "I'm sorry, Mommy. I should have told you sooner." Sarah's heart broke. "No, baby. You have nothing to be sorry for. You did tell us. We just didn't understand how serious it was." "Emma," Dr. Keller said gently, "you were very sick. Your spleen was bleeding inside your body. Do you know what might have caused that? Did you fall or bump into something hard?" Emma shook her head. "I don't think so. I just started feeling bad. Tired. My tummy got big. When you woke up earlier, you wrote something about Tyler. Do you remember that?" Emma's eyes went wide. The machine started beeping faster as her heart rate increased. "Tyler! Is Tyler okay? Did someone find him?" "Tyler's fine, sweetie," Sarah said quickly. "Dr. Morrison checked on him. He's safe at home." But Emma was shaking her head violently, wincing at the pain the movement caused. No, he's not. He's hurt. He's bleeding. I saw him." "When did you see him, Emma?" Dr. Keller's voice was calm but intent. "I don't know. Days ago? Everything's fuzzy, but he was hurt. He was crying. There was blood." Emma was getting more agitated now, trying to sit up despite the pain. "Why won't anyone believe me? We believe you saw something," Sarah said, trying to soothe her. "But honey, you've been very sick. Sometimes when people are sick, they have dreams that feel real." "It wasn't a dream." Emma's voice cracked with frustration and pain. "I saw Tyler. We were somewhere dark. He was holding his stomach like mine. He was hurt like me. Mommy, please. Someone has to help him." Mark had been silent until now, but he spoke up. "Emma, where were you when you saw Tyler?" At school? At someone's house? Emma squeezed her eyes shut, concentrating. I don't remember. It's all blurry, but I know I saw him. I know he needs help. Tears streamed down her face. Please believe me. Sarah looked at Dr. Keller, who was frowning thoughtfully. Emma, I'm going to ask you something, and I need you to think very carefully. Is it possible you and Tyler were both hurt by the same thing? Emma's eyes flew open. Maybe? I don't know. I can't remember. She started crying harder. I can't remember, and it's important, and I can't remember. It's okay, Dr. Keller said quickly. Don't push yourself. Your brain is still healing. The memories might come back as you get better. But Emma was inconsolable now. The monitors were alarming as her heart rate climbed. A nurse came in with a sedative. Emma, I need you to calm down. Getting upset is making your body work too hard. You need to rest. But Tyler... I'll check on Tyler, Sarah promised. I'll make absolutely sure he's okay. But you need to calm down and let your body heal. Can you do that for me? Emma looked at her mother, desperation and fear warring in her young eyes. Finally, she nodded. The sedative went into her IV, and within minutes, Emma's eyes were drooping again. She fought it, trying to stay awake, but ultimately lost the battle. Her grip on Sarah's hand loosened as she slid back into sleep. Dr. Keller gestured for Sarah and Mark to follow him into the hallway. I don't know what to make of what Emma just said. It's possible she's mixing up memories, conflating her own injuries with something she saw on TV or in a book. But her certainty is troubling. Should we call someone? Mark asked. The police? If there's even a chance Tyler's hurt. Dr. Morrison confirmed Tyler is fine. If Emma continues to insist on this when she's more lucid, we can pursue it further. But right now, I think we need to focus on Emma's recovery. The fact that she's conscious and talking is excellent progress. We'll keep monitoring the brain swelling and the platelet count. If those continue to improve, Emma should be out of danger soon. Sarah wanted to feel relieved. Emma was awake. She was talking. The crisis seemed to be passing. But Emma's words echoed in her mind. Tyler hurt bad. Help him. The conviction in her daughter's voice had been absolute. What if everyone was wrong? What if Tyler was hurt and no one knew? Back in Emma's room, Sarah pulled out her phone again. She called Dr. Morrison. Voicemail. She tried David Morrison's number, which she'd gotten from the school directory last year. It rang 4 times before a sleepy male voice answered. Hello? David? This is Sarah Chen, Emma's mom. I'm so sorry to wake you, but I need to ask about Tyler. Tyler? What about him? David sounded confused and annoyed. Is he there? Is he okay? Of course he's okay. He's asleep. Why are you calling about my son in the middle of the night? Can you check on him? Please? Emma's been saying something happened to him, and I just need to be sure. Emma is clearly confused from her medical issues. My son is fine. Please don't call this number again. The line went dead. Sarah lowered the phone, staring at it. David had sounded genuinely annoyed, but also... Was there something else in his voice? Defensiveness? Or was she imagining things? Seeing suspicion where there was only irritation at being woken up at 3:30 in the morning. What did he say? Mark asked. That Tyler's fine and to stop calling. Sarah rubbed her eyes. I'm being crazy, aren't I? Emma's confused. Tyler's safe at home, and I'm harassing people in the middle of the night. You're being a worried mother. There's nothing crazy about that. But maybe we should trust that the adults who've actually seen Tyler know more than Emma does right now. Sarah nodded, but she couldn't shake the feeling that they were missing something important. The rest of the night passed quietly. Emma slept peacefully, her vital signs remaining stable. When morning came, Dr. Huang returned to check the latest blood work results. Emma's platelet count is rising, she announced. Not dramatically, but it's moving in the right direction. The transfusions are working. We're still waiting on the bone marrow biopsy results to determine the underlying cause. But for now, Emma seems to be stabilizing. So she's going to be okay? Sarah asked, afraid to hope. I believe so. She'll need to stay in the hospital for at least another week, possibly 2. We need to monitor her closely and continue treatment. She lost her spleen, which means she'll be more vulnerable to certain infections for the rest of her life. She'll need vaccines and antibiotics prophylactically. But yes, I think Emma is going to recover. Sarah felt tears streaming down her face. After days of terror and uncertainty, finally some good news. Emma was going to be okay. She was going to live. Mark wrapped his arms around Sarah and they held each other, crying with relief. When they pulled apart, they found Emma's eyes open, watching them. "Are you crying because I'm okay?" Emma asked, her voice still hoarse but stronger than before. "Yes, baby," Sarah said, moving to the bedside. "The doctor says you're getting better." "Good." Emma paused, then said quietly, "Did you check on Tyler?" Sarah's relief dimmed slightly. "Yes, sweetie. I talked to his dad. Tyler's fine." Emma's face crumpled. "He's not. I know he's not. Why won't anyone believe me?" "Emma, honey." "I remember now," Emma said, her words coming faster. "We were at his house, in the basement. His dad was there. He was angry. Really angry. Tyler was trying to protect me and his dad hit him. Hard. In the stomach. Tyler fell down and there was blood and then—" Emma squeezed her eyes shut. "Then it's fuzzy again. But I remember that part. I remember Tyler getting hurt." Sarah's blood went cold. "Emma, when was this? When were you at Tyler's house?" "I don't know. A while ago. Before I started feeling sick. Maybe a month." Sarah looked at Mark, seeing her own horror reflected in his face. If Emma was remembering correctly, if this wasn't a medication-induced hallucination, then Tyler had been physically abused by his father. And if Tyler had been hit in the stomach hard enough to cause internal injuries like Emma's. "I need to make a call," Sarah said. She stepped into the hallway and dialed Dr. Morrison's number again. This time, the pediatrician answered on the second ring. "Sarah, I saw I had missed calls from you. Elaine, I need you to listen to me very carefully. Emma is remembering things. She says she was at David's house about a month ago and that David hit Tyler in the stomach. Hard enough to make him bleed. If Tyler has the same platelet disorder Emma has, and he was hit that hard." There was silence on the other end. Then Dr. Morrison said in a voice that had gone very cold, "David hasn't brought Tyler in for any medical appointments recently. I haven't seen him since his last well-child visit 6 months ago. Emma thinks Tyler is hurt. Badly hurt. And if he's been bleeding internally like she was—" "Oh my God." Dr. Morrison's voice cracked. "David wouldn't let me see him last week. He said Tyler had the flu and didn't want visitors. I thought he was just being overprotective, but what if—" She didn't finish the sentence. "I'm calling 911. I'm going to David's house right now. We should call the police. I am the police call. I'm Tyler's mother, and if he's hurt, if he's been hurt this whole time—" Dr. Morrison's voice broke completely. "I have to go. I have to get to him." The line went dead. Sarah stood in the hallway, her heart pounding. What had they just unleashed? What if Emma was wrong? What if this was all a misunderstanding and they'd just destroyed a man's life based on the confused memories of a sick child? But what if Emma was right? Sarah went back into the room and told Mark and Dr. Keller what Emma had remembered. Dr. Keller's face went pale. If Tyler was hit hard enough to rupture his spleen and he's been bleeding for weeks, he didn't need to finish. They all knew what that meant. Tyler could be in the same critical condition Emma had been in, or worse. And no one had known because no one had believed Emma. Detective Torres arrived 20 minutes later. She interviewed Emma carefully, asking detailed questions about the basement, about David Morrison, about what exactly she remembered. Emma did her best to answer, but large chunks of her memory were still foggy. She remembered the basement was cold and smelled musty. She remembered Tyler crying. She remembered David's face, red with anger. She remembered pain, though she couldn't say if it was her own pain or Tyler's or both. "Emma, do you remember David hitting you?" Torres asked gently. Emma frowned, concentrating. "Maybe. I remember him grabbing my arm, shaking me, Tyler was yelling at him to stop. Then Tyler got hit and fell down. Then I don't remember. It's blank. That's okay. You're doing great. Torres made notes. Emma, this is very important. Did you tell anyone about this? Your parents, a teacher, anyone? Emma shook her head, tears leaking from her eyes. I was scared. David said if I told anyone, Tyler would get in worse trouble. He said it was Tyler's fault for making him angry. I was just trying to protect Tyler. Sarah felt sick. Her 7-year-old daughter had been carrying this terrible secret for weeks, scared and confused, thinking she was protecting her friend. And that secret had nearly killed her. Torres excused herself to make calls. Sarah could see her in the hallway, speaking urgently into her phone. Through the doorway, Sarah caught fragments. Possible child abuse. Second victim. Internal injuries. Need immediate welfare check. Mark sat down heavily in the chair beside Emma's bed. Why didn't you tell us, Emma? We could have helped Tyler. I was scared, Emma whispered. And then my tummy started hurting and I felt so tired and I forgot about it sometimes. It felt like maybe it was a bad dream. But it wasn't a dream. It was real. She looked at her mother with huge, frightened eyes. Tyler needs help, Mommy. Please. People are going to help him, Sarah promised. Right now. The police are going to make sure Tyler is safe. But even as she said it, Sarah felt dread pooling in her stomach. If Tyler had been bleeding internally for as long as Emma had, possibly longer, and no one had gotten him medical care, she didn't want to think about what the police might find when they reached him. The next hour was agonizing. Sarah kept checking her phone, expecting a call from Dr. Morrison, from the police, from someone with news. Nothing came. Emma dozed fitfully, occasionally waking to ask if Tyler was okay yet. Each time, Sarah had to tell them they didn't know. Finally, at 9:30 in the morning, Detective Torres returned. Her face was grim. She asked Sarah and Mark to step into the hallway, which Sarah knew meant the news was bad. We found Tyler, Torres said without preamble. Dr. Morrison got to the house before we did. David tried to prevent her from seeing Tyler, but she forced her way in. Tyler was in his bedroom, semi-conscious. His abdomen was severely distended, much worse than Emma's was. Dr. Morrison called 911 immediately. Tyler's being transported here now. Dr. Keller is being briefed. Is he going to be okay? Sarah asked. Torres's expression was carefully neutral. He's alive. That's all I can tell you right now. David Morrison has been arrested. He's being charged with 2 counts of felony child abuse causing serious bodily injury. There may be additional charges depending on the extent of Tyler's injuries. Sarah felt tears running down her face again. But these were different tears. Tyler was alive. They'd found him in time. Emma's desperate insistence had saved her friend's life. Can I tell Emma? Sarah asked. Yes. But be prepared for her to have a strong reaction. She's been through significant trauma herself, and learning that her memories were real, that Tyler was really hurt, may be difficult to process. Sarah went back into the room. Emma was awake, watching the door. Did they find Tyler? Sarah sat on the edge of the bed and took her daughter's hand. Yes, baby. They found him. He's hurt like you were, but the doctors are going to help him. Dr. Morrison got to him in time because of you. Because you remembered and you told us. You saved Tyler's life. Emma started crying. Not the quiet tears she'd been shedding before, but huge, racking sobs that shook her whole body. Sarah held her daughter carefully, mindful of the IV lines and her healing incision, and let her cry. Mark joined them on the other side of the bed. They held Emma between them while she cried out weeks of fear and pain and guilt. I should have told sooner, Emma sobbed. I should have been braver. No, Sarah said firmly. You were incredibly brave. David told you that you'd make things worse for Tyler if you told, and you believed him because you were trying to protect your friend. But you did tell Emma. When it mattered most, when Tyler needed help, you told us. You saved him. It took a long time for Emma to calm down. When she finally did, exhausted from crying, Dr. Keller came in with an update. Tyler just arrived. He's in surgery now. His condition is critical but similar to what Emma's was. He also had a ruptured spleen and massive internal bleeding. If Dr. Morrison had arrived even a few hours later... He didn't finish the sentence. He didn't need to. Emma looked up at him with red, swollen eyes. Will Tyler be okay? I hope so. He's young and strong just like you. And he has the best medical team taking care of him. But Emma, I need you to understand something. You and Tyler both have a condition called idiopathic thrombocytopenic purpura. It's a blood disorder that makes your platelets very low. That's why you both bled so much from injuries that might not have been as serious in other children. We're still running tests to understand why you both have this condition. Is it because of what David did to us? Emma asked. No. The ITP is something that was already present in your bodies. But it made you much more vulnerable to injury. A hit that might have just been a bad bruise for another child caused serious internal bleeding for you and Tyler. David Morrison didn't know about the condition, but that doesn't excuse what he did. He hurt both of you, and he's going to face consequences for that. Over the next few days, both Emma and Tyler slowly improved. Emma was moved out of the ICU to a regular pediatric floor. Tyler remained in intensive care longer, his injuries having progressed further than Emma's before treatment, but he too began to stabilize. Dr. Morrison spent every moment she could at Tyler's bedside, her face drawn and aged by the guilt of not having known what her ex-husband was doing to their son. The full story emerged through police investigation and Emma's gradually returning memories. About 6 weeks earlier, Emma had been at Tyler's house for a play date. David had been drinking and became angry about something minor, the children being too loud or leaving toys out. He'd started yelling at Tyler. Emma, frightened, had tried to intervene. David had grabbed her roughly, shaking her. Tyler had jumped on his father, trying to make him let Emma go. David had struck Tyler hard in the abdomen, then hit him again when Tyler doubled over. Emma had been pushed aside and hit her own stomach on the corner of a table as she fell. Both children had internal injuries from that day, but neither understood how seriously they were hurt. The ITP meant they bled more than normal children would have from such trauma. Their spleens, already fragile from the low platelet counts, had begun to rupture. Over the following weeks, both children had slowly bled internally, their abdomens gradually distending with blood. David had noticed Tyler was unwell, but had attributed it to the flu and refused to let Dr. Morrison see him, afraid she would discover the injuries. Emma had tried to hide her symptoms, scared of getting Tyler in trouble. It was a perfect storm of abuse, medical complications, and fear that had nearly killed both children. David Morrison was held without bail. The charges against him mounted as the investigation continued. Child abuse, assault, child endangerment, and potentially attempted murder depending on how the prosecutor's office decided to proceed. Dr. Morrison filed for sole custody of Tyler and a restraining order, preventing David from ever contacting their son again. Emma was discharged from the hospital after 10 days. She would need to take antibiotics daily for at least a year to prevent infections now that she no longer had a spleen. She would need regular blood tests to monitor her platelet count and medication to manage the ITP. She would need therapy to process the trauma of what she'd experienced. But she was alive, she was healing, and she had saved her friend's life. Tyler was discharged 2 weeks after Emma. He came to visit her the day after he got home, his mother driving him over. The two children hugged carefully, both still tender and healing. They sat together in Emma's room and talked quietly while their mothers watched from the doorway. "I'm sorry I couldn't protect you better," Tyler said, his voice small. "You tried," Emma replied. "You were brave. We both were. My dad's in jail. My mom says he's going to stay there for a really long time." "Good. He was mean and scary, and he hurt us." Tyler nodded. "My mom says we're going to talk to someone who helps kids who've been hurt. She says it will help us not be scared anymore." "My mom says that too. Maybe we can go together?" They decided they could, and Sarah made a note to discuss coordinated therapy sessions with Dr. Morrison. The children would need each other's support as they processed what had happened to them. As the weeks passed and both children continued to recover, Sarah found herself reflecting on how close they'd come to tragedy. If Dr. Morrison hadn't ordered that emergency ultrasound, If Emma hadn't been brave enough to speak up about Tyler despite her confusion. If anyone had dismissed Emma's concerns just one more time. So many moments where things could have gone differently, where both children could have been lost, but they hadn't been. They'd survived. And in the process, Emma had learned that speaking up about danger, even when you're scared, even when someone threatens you, is always the right choice. It was a terrible way to learn that lesson, but it was learned nonetheless. 3 months later, on a warm autumn afternoon, Sarah drove Emma to the park. Tyler and Dr. Morrison met them there. The children ran off to play on the swings, both moving a little carefully still, but with the resilience of youth, allowing them to bounce back from trauma that would have broken adults. Dr. Morrison sat beside Sarah on a bench, watching the children. "I still can't believe I didn't see it," she said quietly. "I'm a doctor. I should have noticed Tyler was sick. David kept you away from him. He knew you'd figure it out if you saw him. I should have insisted. I should have known something was wrong. I knew David had anger issues, but I never thought he'd hurt Tyler. Certainly not like that." Sarah reached over and squeezed Dr. Morrison's hand. "You saved him." When Emma told us what she remembered, you didn't dismiss it. You didn't say it was impossible, or that Emma must be confused. You went to check on him immediately. You saved your son's life. Emma saved his life. She remembered what happened even though her brain was shutting down. She fought to tell us even though she could barely stay conscious. That little girl is a hero. They sat in companionable silence, watching Emma push Tyler on the swing. Both children were laughing now, the sound clear and bright in the autumn air. They would carry scars, both physical and emotional, from what they'd endured. But they would carry strength too. They'd survived something terrible together, and that bond would last a lifetime. Sarah thought about that terrible day when Emma had woken up and written those 2 words. Help him. How easily those words could have been dismissed. How easily Emma's concerns could have been written off as medication-induced confusion, or the strange dreams of a sick child. But Sarah had listened. Dr. Morrison had listened. Detective Torres had listened. And because they'd listened, 2 children were alive and healing, instead of becoming statistics. Emma ran over to the bench, breathless and grinning. "Mommy, can Tyler come over for dinner?" Sarah looked at Dr. Morrison, who nodded. "Sure, sweetie. Tyler can definitely come to dinner." "Awesome." Emma started to run back to the swings, then stopped and turned around. She came back to Sarah and wrapped her arms around her mother's waist, squeezing tight. "I love you, Mommy." Sarah hugged her daughter close, breathing in the smell of her hair, feeling the warmth of her small body. "I love you too, baby. So much." Emma pulled back and looked up at Sarah with those serious eyes that had seen too much for a 7-year-old. "Thank you for believing me. About Tyler." "Always," Sarah promised. "I will always believe you. No matter what." Emma smiled, satisfied, and ran back to play. Sarah watched her go, her heart full of gratitude and love, and a fierce determination to protect this precious child who had been so brave, so strong, so determined to save her friend even when no one believed her. The sun was setting now, painting the sky in shades of orange and pink. The children played until the last light faded from the sky, their laughter carrying on the evening breeze. 2 children who should have died but didn't. 2 children who found the strength to survive and the courage to speak truth even when it was terrifying. As they drove home that evening, Emma in the back seat chatting about her plans for Tyler's visit, Sarah sent up a silent prayer of thanks. Thanks that Emma was alive. Thanks that Tyler was alive. Thanks for emergency ultrasounds and persistent pediatricians and children who refused to give up. Emma's stomach had stopped growing. The blood had been drained, the spleen removed, the medications working their magic. But more than that, Emma's voice had been heard, and that voice had saved not just herself, but the friend she'd been trying so desperately to protect. In the end, that was what mattered most. Not the medical mystery, or the dramatic surgery, or even the arrest of David Morrison. What mattered was that 2 children had been given a second chance at life, and that was worth everything. Sarah joined a support group for parents of abuse survivors. sat in church basements with strangers who became friends, bonded by shared trauma and collective healing. Heard their stories, shared her own. Found that speaking about it, again and again, slowly drained the poison from the wound. One woman's son had been abused by a coach, another's daughter by a family friend, a man's 2 sons by their grandfather. The faces of predators were varied, but the patterns were always the same. Trust exploited, authority weaponized, innocence stolen, and always, the survivors left to pick up pieces and rebuild. Emma started painting as a new form of expression, a hobby Dr. Morrison encouraged. Her paintings were vibrant and alive, full of color and movement and hope. One showed a girl with red hair standing on a mountain, sun rising behind her. Another showed hands reaching up from darkness toward light. Yet another showed a garden growing from cracked ground. Sarah bought frames for all of them, hung them throughout the house. Emma's art became a visual timeline of her healing, each piece marking progress, growth, transformation from victim to survivor to thriver. On the first anniversary of calling 911, Sarah took Emma to the beach, far from Riverside and its memories. They walked along the shore collecting shells, watching waves crash against rocks, feeling salt spray on their faces and sand between their toes. "Mommy," Emma said, her voice thoughtful. "Am I going to be okay?" Sarah knelt in the sand, taking her daughter's face in her hands, looking into eyes that had seen too much, but still held light. "You already are okay. You're more than okay. You're extraordinary. But I'm different now. I'm not the same Emma I was before." "No," Sarah said honestly. "You're not. But different doesn't mean broken. You survived something terrible and you're still here. Still laughing. Still loving. Still being brilliantly, beautifully you. That's not broken, baby. That's triumph." Emma thought about this, her small face serious, processing in that way children do when learning profound truths. Then she smiled, that gap-toothed smile Sarah loved more than anything in the world. "I'm a survivor. Dr. Linda says survivors are the strongest people there are. Dr. Linda is absolutely right." They stayed until sunset, watching the sky turn orange and pink and purple, the colors bleeding into each other like watercolors. Emma drew pictures in the sand with a stick, stories of adventure and bravery and dragons defeated by girls with red hair and big hearts. The tide came in and washed them away, but that was okay. Tomorrow she would draw new ones. Driving home in the dark, Emma fell asleep in the back seat. Her stuffed rabbit clutched to her chest, her face peaceful in the glow of passing streetlights. Sarah watched her in the rearview mirror and thought about that terrible night when everything changed. The blood on the sheets, the desperate 911 call, the fear that had consumed everything. But she also thought about the strength they'd found, the community that had rallied, the justice that had been served, the healing that was happening, slow but sure, like flowers growing through cracks in concrete. Her phone buzzed at a stoplight. Detective Brennan. "Just wanted you to know, Warren's appeal was denied, and the FBI investigation led to arrests in 3 other states. Men he was connected to online. Your decision to call 911 that night, Emma's bravery in speaking up, it had ripple effects we're still discovering." "How many children?" Sarah asked, knowing the number would be high, bracing herself. "At least 30 that we know of. Probably more we'll never identify. But because Emma spoke up, because you believed her and acted immediately, we're stopping it now. Every day those men are in prison is a day children are safer." Sarah thanked her and hung up. She thought about all the parents who would never make the call she made, who would convince themselves they were wrong, who would choose doubt over protection. She thought about the systems that had failed, the institutions that protected predators over victims, the way society made it easier to dismiss children's voices than to confront uncomfortable truths. But she also thought about the ones who would hear Emma's story and be brave enough to believe their own children, the ones who would trust their instincts, the ones who would choose their children over their comfort, truth over convenience, protection over reputation. They pulled into their driveway, home, safe, together. The porch light was on, casting warm yellow light over the front steps. Inside, Diane had stayed to prepare dinner. Probably soup and fresh bread. Comfort food for coming home. Sarah carried Emma inside, still sleeping, and tucked her into her own bed. Emma stirred slightly, smiled in her sleep, and settled deeper into her pillow. Sarah smoothed the wild auburn curls back from her daughter's forehead and whispered the same thing she whispered every night. You are loved. You are safe. You are mine. And you are so much stronger than you know. Emma stirred, her eyes fluttering open for just a moment. I know, Mommy. I can feel it. Tomorrow would bring new challenges, more therapy, more growing, more learning to be Emma after trauma, rather than Emma defined by trauma. But tonight, they had this: peace, safety, hope, a future that looked different than the past, but held possibility nonetheless. Sarah watched her daughter drift back to sleep, then went downstairs where Diane waited with soup and understanding, and the kind of love that doesn't ask questions but simply shows up with groceries and determination. Outside, Riverside slept on, changed by what had happened, by the revelation that darkness could wear a collar and preach sermons and help children with their reading. The community had fractured and was slowly, painfully rebuilding itself, with new awareness, new protocols, new commitment to protecting the vulnerable. But in this house, in this moment, there was just a mother and her daughter and the aunt who loved them both. There was soup and safety and the absolute certainty that they had survived the worst and were still standing. And that, Sarah thought, as she sat down to eat with her sister, was everything.